How should you look after and take care of your stitches after childbirth? Hi, I'm Angie and I'm at the Eco Midwife. For anyone I haven't met yet, I've been a practicing midwife for the last 13 years. So, as a starting point, you need to try and keep this area as clean and as dry as you possibly can. And when you change your pads, they need to be changed really regularly. You need to be changing these every couple of hours, even if you don't need to change them from a heaviness, dampness, wetness perspective. When you go to the packet or to your bag to get out your pads, make sure you wash your hands before you take it out after going to the toilet, and then wash your hands afterwards. The reason being, what you don't want to have done is gone to the toilet, had a wee or a poo for example, then put your hands directly on this pad that you've just taken out of a fresh clean packet that's going to sit against these stitches for the next few hours with potential bacteria on your hands that have gone onto the pad that are going to sit against those stitches that need to be kept clean and healing well. So hand hygiene is so important when it comes to caring for your stitches. Almost all stitches that are used for helping bring that perineal tear back together or the episiotomy back together are dissolvable. What that does mean is you really do need to keep this area clean, but it also means that you haven't got to go through the process of having any stitches removed, which is far more comfortable. And the stitches will take a couple of weeks to really heal, and for the whole area to recover, probably more like 4 to 6 weeks. If you have continued ongoing pain in the perineal area beyond this time, speak to your GP for a women's health physio referral, get them to have a look at it, get them to assess it and see it. Or alternatively, consider paying privately for a mummy MOT who will go through the recovery and rehabilitation of the scar tissue. Please don't suffer in silence. There are things that can be done to help it if you need to, and it will depend on the assessment of that from a women's health physio and potentially a gynaecologist longer term. Bath or shower daily, but avoid any perfume products or any products in the bath if you are going to have a bath sooner. You can absolutely use shower gel on your body, that's not a problem, but what you don't want to be doing is sitting in a bath with any sort of products that may delay that healing. After your bath or shower, no rubbing of this area, just pat dry with a nice clean towel, and that will just help prevent any discomfort around those stitches. Very occasionally, arnica and lavender can sometimes be recommended to help speed up the perineal healing side of things. Have a conversation with your healthcare professional first, because there are risks and benefits and there are also side effects to these that just need to be discussed, but also looking at your own individual medical history as to whether this is appropriate or a possibility for you. Pain and discomfort is incredibly common following having perineal stitches, and there are things that you can do to help, and that includes taking things like paracetamol, for example, non-steroidal anti-inflammatories like ibuprofen or diclofenac, for example. Have a conversation with your midwife what you're eligible for, what you can take. If you take any opioid medications, something like dihydrocodeine, for example, just consider a laxative as well, because the last thing you need is constipation in that postnatal period. Constipation on top of stitches is a real pain in the arse. Try to eat a well-balanced diet with lots of fruit and vegetables, because that will also help promote healing as well. Rest also helps with healing. So whilst, yes, you do need to move around and walk absolutely in that postnatal period, it's really important that you do sit down and you do rest. You don't overdo it in that postnatal period. Think about positions that you can adopt to help with comfort levels as well. This might be on your side, for example. That might make it feel more comfortable. You may want to consider other adaptations with pillows and everything else, depending on where the stitches are, how they feel, and what is your comfort levels. Pelvic floor exercises are really important in that postnatal period to prevent long-term incontinence and any problems further down the line. Once you feel comfortable enough, just start doing some pelvic floor squeezes, some pelvic floor lifts. After that, you can absolutely build it up to your pre-pregnancy pelvic floor, but you just want to start small, slow, and then build it up over time. If it feels really uncomfortable, maybe just pause, give it a day off, and try again tomorrow. When it comes to passing urine for that first time, it can sting sometimes, and this is where the more hydrated you are, the better it will be for you, because the less concentrated the wee, the less salt concentration, therefore the more comfortable it will be around the stitch area. The other thing that you can consider is that as you pass urine, that you have like a jug of water, and that you, as you are weeing, just sort of douche down, and it will just help prevent and reduce the stinging that you may feel. Each day that you have a postnatal check by a midwife, you should be offered a check of your stitches down below, and that will just enable your midwife to have a look at it. You don't have to have that, it requires your consent, but it might just provide you the reassurance about the healing side of things. Your GP can also do this for you at 6 weeks postnatal too. In terms of resuming sex, the stitches ideally need to heal before you resume intercourse again. When you are ready to resume sex again, consider some lubrication for the first few times, just to make it feel more comfortable. Any pain, any discomfort, talk to your GP, women's health physio, they can help. And if you have any concerns in that postnatal period about your stitches healing, if you suddenly feel like it's feeling really edematous and swollen, if you feel like there's suddenly new onset pain that you weren't used to, if that pain is excruciating and no paracetamol, no ibuprofen, no pain relief is touching it with a barge pole, if you are having smelly offensive loss, if you've got green discharge, for example, if you feel like it's gaping or coming open, please talk to your healthcare professional, give them a phone call. Maternity services are available 24/7, 365 days a year. Give them a call. Other signs of infection include feeling hot, cold, shivery, nausea, vomiting, fever, abdominal pain, particularly if it's new after pains as well. And as bizarre as it might sound, I've had some women hand me a phone in that immediate postnatal period of the suturing side of things, hand me their phone and ask me to take a photo of what it looks like afterwards. And then they like that as a comparative over a number of days. They can have a look at it in the mirror themselves. They know exactly where it is. They know the degree of tearing. They know where those stitches are. And if it's something you want to do, you just need to hand your phone to a midwife or your partner. Your partner can do this as well, to get them to take a photo for you on your own phone. For some women, it just gives them the additional reassurance that they can see what it looks like on day 0 and then have a look at it further down the line. I would highly recommend that at some point you do look at it with a mirror so that you know the degree of tearing, where it is, how it looks. It'd be really useful for you to look at it at some stage and understand what's happened around your perineal area, the degree of stitching, and also that healing process. After all, it's your own vagina and vulva.